Everyone, good to see you. I'm Joseph Shapiro, co-founder of Psychedelic League with Sara Price. Sara, you want to take it from here?
Yeah, totally. So I am Sara Price. I'm a board certified nurse coach. And as Joe mentioned, the co-founder of Psychedelic League. And we're super excited today to have Jessica Tracy on. Jessica, welcome. Jessica is the head of growth and partnerships at Anthea, where she leads educational initiatives and coverage expansion efforts across employers, unions, and employee assistance programs, expanding on insurance access for psychedelic assisted therapy. Jessica is also the CEO and founder of the SAGE Collective, which is a purpose-led consulting firm dedicated to integrating psychedelic assisted therapy into the current healthcare ecosystem. She holds various certifications from Sound Mind Institute, which was with Hannah McLean, who we had on previously. And she has also earned multiple insurance designations, including group benefits disability specialist and commercial lines of coverage. Commercial lines coverage specialist. And Jessica, as we were talking about before, you also have a really, really expansive set of experience within both the healthcare space, as well as the work you've been doing with Anthea and into psychedelics. So I'll let you kind of dive a little bit into your background and then how you ended up in the psychedelic space.
Great. Thank you. And first of all, thank you for having me. I'm super excited to be here with you all. And I'm thrilled about all the work that you are doing to create access. And it's great to be here. So hello for everyone joining today. Again, super excited to be here. So to start off with my background, I've spent all of my career in the healthcare and employee benefit space. And I started out in insurance, group insurance, working as an underwriter at a large insurance carrier, and then transitioned into the employee benefits consulting space, where I focused on data analytics and also cost containment and health and productivity strategies for large employers, for unions, for public entities. And then after about a decade of doing that, I transitioned over to the clinical genetic space, again, still in the employee benefits ecosystem. And actually the clinical genetics work that I did there at my prior firm is not too dissimilar to what's going on within the psychedelic space today. So these were screenings that had a ton of research and data supporting their efficacy, and they weren't covered by traditional insurance. So a lot of the work that I did there was working with employers, unions, even health systems and TPAs to help bring those in network and get them covered. So again, not too dissimilar to what we'll be talking about today with psychedelics. And from a personal perspective, I really connected to psychedelics through my own personal experience. And that's ultimately what brought me into the work that I'm doing today, both with the SAGE Collective and also with Anthea. And that is primarily just due to using these medicines to support my own mental health. So I was someone who had always struggled with anxiety to varying degrees of severity, and going to working with doctors, I got various diagnoses. And it was something that I dealt with for a long period of time. And I used the traditional approach, just like if you were going to a doctor, like most doctors would do, they would give you your scripts, and those scripts included SSRIs, which, I know has seen a huge increase in usage and in volume. Also sleeping pills, because my sleep wasn't great with the anxiety, Xanax for panic attacks, because they occur quite often with anxiety as well. And then also Adderall, because I wasn't feeling rested and, I couldn't really make it to my day and I was distracted. I mean, I could, but I felt a little distracted. So I would say that's not too dissimilar to, I think, what most people go through when they have, when they're dealing with mental health challenges like anxiety. And I'll also say, I think I used other coping mechanisms as well. So, I was socializing, on the weekends. I was also networking a lot with my job. So that led me to be drinking, wine a decent amount. And, looking back at it now, I could say that I was definitely using wine as an additional way to cope, which I know, many people do. And then I was also using work as a huge distraction factor. I was always working. I was a career woman and, pouring everything I had into my career, which I still do. But I would say I was doing so in maybe not so much of a healthy way, because I was putting way too much time really to distract myself from anxiety. And, this really went on for about 15 years. And I just got to a point where I said, I can't keep living this way. I don't want to have to rely on medication for the rest of my life. And, at some point you would think that, you're going to be taking these medicines and eventually like not feel anxiety anymore. And in my mind, it was just something that really made me feel somewhat, I would say, numb in some respects, because these medicines really work to just mask your symptoms, numb those symptoms. And I didn't want to feel that way. And, the Xanax was really what helped me at night. So, I would say I was kind of cautiously dependent. I would use it not all the time, but, enough. And you're not supposed to use that long term. And it just got to a point where, sometimes like words wouldn't come to me as well, or I just didn't feel as sharp. So these side effects that come along with these traditional medicines are very, very real, and also there's challenges with getting off. But I knew there had to be a way. So fortunately, I came across psychedelics. First, I worked with psilocybin internationally where it was legal. And then when I was in the States, I had the opportunity to work with ketamine-assisted therapy. And I actually did I worked with ketamine-assisted therapy through Sound Mind and some other places as well. Sound Mind's wonderful. And through those experiences, what happened for me was that I was able to get to really not masking those symptoms, but understanding what was actually causing those symptoms. So what was the root cause? What was the driver of what I had been experiencing for so long? And in doing so, and in working with specialists and therapists in conjunction with using the medicine, I was able to process these stored emotions, these that were connected to these micro and macro traumas that I had happened to me over the course of my lifetime, and probably just general stressors as well. And I was able to process these experiences, and through that, really able to let go of a lot of those symptoms. So it was almost as if just over time, those symptoms just started to subside through the work that I was doing and through working, through the medicine itself. So I had such transformation in using these medicines that I had to find a way to get involved. I had to find a way to kind of dedicate my time, my efforts, and and having such an extensive background in group insurance and knowing my own experience in not being aware of, what's the best protocol for ketamine-assisted therapy, who are safe providers, who are the best providers. There was a lot of stuff that I didn't know, especially even as a healthcare and insurance professional. And in my mind, I just thought, people really need this. People are struggling, and so many people are relying on, traditional ways, and they work for some people, but there's many people that it doesn't work well or well enough. So I wanted to bring awareness. I found Enthea, and I was so excited about the work that they were doing around creating access, educating employers, actually creating an actual product so that employers could cover these incredible therapies. So, we connected, and I was just super excited about being able to really educate the employee benefits ecosystem, those in the community about these medicines, some of the reasons why employers need to do it, and unions, and really what the gaps are in their current mental health care strategy. So that's how I got into it, and I'm just loving this work, and I'm super grateful to be able to help create awareness and educate here.
I think that that's one of the things that you really find in this space is that those with like an incredible amount of passion for this work, it's always rooted in a personal experience. And it's like once you've seen the potential for healing that it holds, you're like, and at first you're always like, we should all do this. And it's like, okay, maybe not every single person. It's not right for every single person, but like, you see this path for doing things a little bit differently, or very, very differently, a lot differently.
Absolutely.
Yeah, when you talk to employers, and when employers are kind of contemplating this, like, what is the receptivity of employers to this? Are they hesitant, or are they excited for it? Do they need more education? Like, what is that the vibe there?
Yeah, absolutely. It's a great question. I've been really excited about the receptivity from employers and unions. I think at this point, employers are seeing that, there's been a continuous increase in SSRIs and mental health medications. There's also a continuous increase in mental health conditions, the prevalence within their population. And they're not seeing, many are not seeing a decrease necessarily. So I think what they're coming to understand is, while we have had some innovations in mental health programs, the EAPs, they've had some innovation in creating, more culturally diverse access to therapists, which is amazing, and better digital and virtual access to therapists, which were absolutely necessary. But the reality of it is we still have just had access to the same tools in our toolkit, right? So medication, therapy, and that does not work for everyone. In fact, across various conditions, so looking at PTSD, depression, anxiety, substance use disorder, the percentage of the population that is resistant to conventional therapies, meaning that they do not respond to conventional approaches, is anywhere between 30 to 60%. So when I'm talking to employers, I think, some may have been familiar with treatment-resistant depression, but most are not familiar that that's across, many other conditions as well. So I try to help them see that, you're doing amazing with, try to do everything you can with the tools that you've had available for your mental health care strategy, but we need to do more. And there's now approaches that are super safe, a ton of supporting evidence and research around these therapies that really should be looked at. And I would say, and I helped them to understand too, maybe it's not for everybody, to your point, Sara, but if we can at least start with the population that is treatment resistant, that, has nothing, that really has very minimal options for them. And we know that these therapies are highly, highly effective, especially for that population. And when you have someone that has been struggling with, treatment resistant conditions, the amount of trial and error that they have to go through is it's a challenge. It's waste from a cost perspective from the employer, but more importantly, it's super tough on the individual, and nobody should have to go through that. And we know with these therapies, they especially when we talk about ketamine-assisted therapy, which is available now for employers and unions to cover, they literally work within hours. So someone that has been struggling with their treatment-resistant depression can come in for these therapies and within hours start to find relief.
That's drastically different than an SSRI, which is months. Go ahead, Sergio.
Yeah, so I think I had to reformulate my question because before I asked it, you already answered it about productivity and the fact that psychedelics can have a downstream effect when it comes to like the expense, right?
Mm-hmm.
At an employer's expense. So, what are some of the numbers you're seeing that you're able to relay to these employers? Because I imagine some are interested in this from an empathy standpoint, but others. And they also, though, on the flip side, also want to know about cost savings or something along the lines of numbers and dollars.
Yeah, absolutely. And we're actually in the process of doing that analysis right now. And the numbers are coming out really well. So I can share more of that in the future. But, there's absolutely savings here, right? So you mentioned productivity. That's a major impact right there. So the whole presenteeism and absenteeism issues when someone has depression, when they have anxiety, they're just not as productive. And I don't want to even say productive because I think that's tough to use when we're talking about mental health, but they're not themselves, right? They can't be the best versions of themselves when they're struggling with fear and worry, or when they're struggling with this kind of sadness, or other types of issues like PTSD. So when someone is able to obviously go through these treatments and have those breakthroughs, find that healing, they can be way more present, way more available, and really just, I would say, kind of operating it at their best, which is what everybody wants. The employer wants that, the employee wants that. So that's a big one. The turnover is an issue too. So we actually have seen a really high turnover rate correlated to mental health conditions, and the highest propensity of that is with millennials and Gen Zers. They appear to be leaving more for mental health reasons, and we know when someone leaves, it's super expensive to bring someone back, turnover, and ultimately you want your employees to be there, be happy. From a cost perspective, there's definitely savings from somebody going through these therapies. If you look at someone that's using medication and talk therapy year over year, that can add up and it can be quite expensive on an annual basis. And when we compared just that alone, there is an ROI there for someone using ketamine-assisted therapy, going through 6 sessions and then they're done, versus them continually year over year having to use ongoing chronic treatments. There's also a brand name ketamine that is covered today by most insurance plans. And of course, when you have a brand name instead of a generic version of the medication, it's going to be super expensive. So our approach is to use generic ketamine, which is an FDA approved medicine, and it's generic. So it's like $2 a dose. Whereas the newer version of ketamine that is covered by traditional insurance, it's $600 to $900 a dose. And whereas our approach is 6 sessions, the other approach is ongoing, where you're not, so it's ongoing. You can continue to use the medicine on an ongoing basis. So that can add up pretty quickly. So if you have someone that's going on a consistent, regular basis, that could be almost $45,000 a year. So lots of savings here, I would say in both direct and indirect cost. And, one other thing I'll add too is when a lot of employers and unions, they look at their claims data, oftentimes they'll look at the direct impact of mental health. So what are the direct claims costs associated with mental health conditions? And oftentimes that's going to be PCP visits for them to go get their medication or, work with their doctor, labs. And in total, they end up being kind of small. So you may not look at your data and say, well, it's only, it's lower than we expected. But there's something called the mental health multiplier when you actually look at kind of the total cost of care for the patient, and you look at how the mental health conditions are also increasing the cost of their chronic conditions. We're finding that individuals that have mental health conditions and chronic conditions are about 128% more expensive than those that don't have mental health conditions. So there's a lot of data just showing obviously the major need to focus on mental health solutions. And I know it's been a challenge because we've only had certain tools, but we're at a really exciting time right now where we have new options available to us. And I'll add one more thing too. As people are going through these treatments, a lot of people are actually getting off of their medications. So for Enthea, we have some outcomes from our population. And we can get into some of those stats, but one of the really compelling stats was that 80% of individuals that went through the treatment, they were no longer on antidepressants at 3-month follow-up. And, that was similar for me. I share my story and all the medications that, the different medications that I was on. And now since I had gone through my treatments, it's been almost 5 years since I've been on any medication at all. I haven't drank for almost 2 years. So for me, I can see that. I could see that from my own proof points, and we're also seeing it within the data. So it's pretty exciting.
That's really, I am so fascinated to hear about that correlation to chronic disease. I mean, even looking at a lot of the SSRIs in terms of like weight gain, and I know there's like some link in there with like carbohydrate metabolism. And when you have weight gain, you increase risk of, diabetes and metabolic syndrome. Like it just sort of like blossoms into this massive, expensive, and not only expensive from like a healthcare standpoint, but when somebody is dealing with those chronic issues, they are not their sharpest self. They're not their most creative self. I mean, this just rooting it here just expands. I'm really excited to actually hear that data because every time we have a conversation with somebody where there's some link, I'm like, but what is the health implication here for like long-term health?
It's a lot. I mean, even when you think about, everyone, it's like, what starts first, right? Does the chronic condition start first, or does the mental health condition start first? And that's, something interesting to really dig into, because we know that mental health conditions like anxiety and depression, they lead to inflammation. And, continuous ongoing inflammation, that can lead to disease. And we also know when you're struggling with these types of conditions, you may not be as motivated to exercise or to take care of yourself, or, getting the rest that you need, which is super important to be healthy. So many times uncontrolled mental health conditions can lead to chronic conditions. And we also know chronic conditions can lead to things like depression and anxiety as well, but then that exacerbates the cost of the chronic condition. So like just any way you look at it, mental health has to be addressed. And I would, I would venture to say that if employers just like double down on getting the mental health of their employees improved, then they would see positive impacts across every other area of their business.
That the term mental health multiplier is such a great term to keep in mind. I know when we originally spoke, I think you had mentioned it, and it was great to hear it again, because that concept is really powerful, that any existing health issue you have will be multiplied by when you don't get your mental health addressed. And then addressing mental health can be something you can do either through just ongoing use of drugs and therapy, or it can be something that you can actually have an end goal, right?
Mm-hmm.
I think one of the things that we hear a lot about psychedelics is that sometimes they're touted as like one and done, which can be true, but not always. But it seems like arguably psychedelics can be more quickly effective, right? And they're not necessarily going to be used in the same way. It's a different paradigm of use, right? Than other drugs and other therapies. How do you differentiate between that paradigm, difference?
Yeah, exactly. And it's a great point to bring up. So, you mentioned what we have today, that most people have, that many people have tried. And those approaches are generally like, they take a long time to work. They have to get into your system. They have to start doing the work, and then eventually they're going to work. They may end up, you may end up needing more as, you continue ongoing with the medicine. Whereas with psychedelics and ketamine, ketamine specifically, it works within hours of the first treatment. So extremely fast acting, I would say one of the fastest acting mental health medications. And, when combined with therapy, it's also long lasting. So the outcomes are sustainable. And, when we think about MDMA and psilocybin, same with them, extremely fast acting. You're starting to get the benefits and the experience of the medicines as soon as you're receiving them. And but it's important to know too, like these medicines, they're not a silver bullet, right? You have to do the integration and the work after. You can't just work with these medicines and expect everything is going to change. You're going to get a lot of guidance and realizations and a better understanding of how to improve your life, how to work through the challenges and the issues that you've been dealing with. But it is about the work that you need to do afterwards that's really going to have those lasting changes. And, that's why I believe this integration is so important after the experience in working with the medicines. And, our approach, Anthea's approach with ketamine assisted therapy, that is incorporating a trained therapist and integration specialist. And, in many instances through psilocybin therapy and also MDMA therapy, there are integration specialists available as well. And I would highly, highly recommend working with that, because you are having a lot come up, and, it's a lot to work through, a lot to understand. But I also look at these medicines as, I would say, catalyst to engaging in healthier coping mechanisms as well. I know for myself, as someone who had, pretty strong anxiety, I couldn't sit in meditation for probably longer than a minute. I was always tapping, and, my knee was going, and I was like, what else can I do? How else can I be more productive, get more done? I didn't want to sit down and do nothing. It's not nothing, obviously, I know now, but that's the way I looked at it. So, in going through these therapies, I have now been able to engage in much more healthy coping mechanisms, much more grounding coping mechanisms that continue to assist in my transformation, that continue to assist in my healing. And I believe that these approaches are super healing and can also, continue that for an individual. But I think for some people that are dealing with such deep depression and anxiety, PTSD, it's really challenging to engage in those types of approaches. So, for me, before, when I would go for like a glass of wine, if I was stressed or if I was, getting panicked, I would have to have, a small piece of Xanax or something. Now it's okay. Well, let me go for a walk and go for a hike, or let me, do a meditation or breath work, which, I find extremely beneficial now, whereas before I couldn't really engage with them.
That's a great way to balance out. And I'm kind of processing, it's, you do a really great job of making these, and I'll use like a lawyer term, arguments. It's not arguments, you're making great points, but like the way to argue them, the fact that psychedelics are fast acting, or faster than traditional drugs. But then you're going to have, it's also a catalyst for change. And that there is work to be, but the paradigm shift is, unlike other drugs that are kind of numbing, right? You're going to have to do the work.
You have to do the work.
Right.
Yes.
So, but it's a great dichotomy. I've never heard it explained that way, that how quickly they work, because they are, right, immediate onset effectively. And it's, I mean, like I know we're in a bubble here, but it just makes so much more sense, that way, than if you look at it just objectively. If you look at the arguments for each one, psychedelics have, like, they win the argument on all those different points.
I would say so.
Especially when you pair it with, I really give you so much credit for pairing your personal story with it, because you're sharing your personal story, you're humanizing it as you're discussing this with employers, which is so important, I imagine, because it's not like you're taking it out of the abstract. So, and I also give you a lot of credit for sharing a personal story, really.
Thank you. I appreciate that. Yeah, it's, I think it's important to be vulnerable. I think it, opens up space for other people to talk about it. Everybody's going through something. There's not one person that's, I think, not going through anything at some point in their lives. So I think it's important to kind of create that safe space for sharing stories like this and sharing what's worked for people. And, we've said this, psychedelics isn't going to work for everybody. And some of the conventional medicines, they're working really well for people. And, that's amazing. But for those people that it's not working for, or where, you don't want to continue to have to, take the same approach in an ongoing basis, these are very incredible options to explore. So yeah, I find it helpful too, because also, when you're bringing something new to an employer, to a union, I think it's really helpful for them to know that you've had experience, and to know that, like, you're doing this work because you believe in it, right? Because it's so important for you, because it's been so successful for you, that you want other people to have access to it. To me, I think that's just really important as part of the process, especially with something that's a bit more new in the industry.
And they can kind of like look at you and see one of their employees, like you are their set of employees. And, it's also an interesting thing that you brought up, like this, but I think, what I kind of think is like really valuable with psychedelics is like these things that sit inside of us, we can, and almost to where I think my personal opinion is that this should be like a first line versus like after you try all of these things, because these things are always inside of you, like these traumas, these, belief systems, these thought bubbles are always there, and we can push them down, and we can push them down for so long, but they will eventually either create disease or will surface and can't be managed anymore. So might as well, like, let's go at it, at its foundation now, so it doesn't become an ongoing issue. Now, I know you mentioned like that they're using ketamine. Obviously, ketamine is what's legal right now. Are you finding, is ketamine something that's easily implemented within all, like, insurance, programs, or is that something that has to be opted into, or how does that actually work within a plan?
Yeah, great question. So right now, when you think about ketamine-assisted therapy, which is using the generic form of ketamine, which was ultimately FDA approved as an anesthetic, it's used in combination with therapy. So when we look at ketamine-assisted therapy, that unique combination is not covered by, I would say, the vast majority of traditional insurance carriers. So if an employer wanted to add on ketamine-assisted therapy today, it is highly, highly likely that their employer or their insurance carrier is not offering that or covering that. Now, as I mentioned, the medicine itself, generic ketamine, is covered under the plan. Therapy is most likely covered under the plan, but this unique combination of the two, where we're using ketamine as a treatment for mental health, is not covered. Now, that is ultimately why Enthea was formed, because we do believe, and of course, are super supportive and confident in ketamine-assisted therapy ability to really, I would say, dramatically improve the mental health of a population. So we have formed ultimately a national network of ketamine-assisted therapists across the country that are specialized in delivering these therapies, and we individually credential every single provider that comes into our network, just like an insurance carrier would. So it's a very rigorous, clinically rigorous process for someone to go through. And we've ultimately established a national network of these providers so that we are able to bring this to employers so that they could add on ketamine-assisted therapy as an ancillary benefit. So similar to how many employers and unions have added benefits like fertility coverage. So it was not covered by traditional carriers, but obviously employers felt that there was a big need there. So some of these vendors out there have put together, same thing, network of specialized providers, and ultimately a benefit that the employer could just add on so that they could add coverage for that very specific thing that they believed in. So it's very similar with ketamine-assisted therapy. Now, I'll say that there is a ketamine that is covered by many insurers today, and that is the brand name version of ketamine. So ultimately, they used a portion of the ketamine molecule, and because it's not the initial ketamine molecule that was approved by the FDA, they went through and ultimately established it as a new drug, and they got it approved as for the treatment of treatment-resistant depression and major depressive disorder with suicidality. And now this medicine is approved and it's covered by many insurance carriers. Now, many people think, oh, that's great. So we have an FDA-approved, insurance-covered drug. Well, as this happens quite often, when you get a new drug on the market and it is a brand name drug, it is extremely expensive. So that is the case with this drug, and it's esketamine is the drug, and the brand name of this is Spravato. And the drug is between $600 to $900 a dose. Now, some of the other challenges that I see with this medication from an employer's perspective, even the employee's perspective, is that the protocol is a bit different than we use with ketamine-assisted therapy, which is short-term treatment, ultimately to help people go through these therapies and get better, get off medications. With this medication, it's you're using on top of your other medications, and it's open-ended too, so you can continue to get access to this medicine as long as you need it. So if someone is going through this therapy using this medication, then and they're going on a regular basis, it could cost an employer up to $45,000. There's also some studies out there that have shown that the medicine is not as effective. So it's shorter acting, meaning people are going to come back. And, it doesn't incorporate things like therapy. They may have their own therapist, which is great if they do. And, when we look at this, we see some challenges with it from an employer benefit perspective, right? It's going to be a really expensive medication. It may even be, that's the next kind of like GLP-1 discussion where you have these really high cost drugs that are coming through your plan. And, when I think about the purpose of using ketamine for mental health, I don't think it should be to have somebody to have another medication that they have to use on an ongoing basis. When we think about ketamine-assisted therapy, it's really with the intention for them to use a highly effective medication that is very affordable. I mean, generic ketamine is dollars a dose compared to $600 to $900 a dose. And we use a low dose of that in this unique combination with therapy, because the medicine itself enhances the outcomes of therapy, ultimately because you're able to relive the experience, reprocess the experience in such a gentle way. It's a dissociative medicine, so you're not going through all the pain, but you are experiencing it again, so you can look at it from a different perspective, and then work with a therapist clinician that's highly specialized in working with these medicines and this type of therapy. And through that experience, people are going through 6 treatments, and on the other side of it, as I mentioned some of the stats earlier, not needing medication anymore. So that's where we really believe employers should be looking to, is something that's highly effective, short-term treatment, cost effective, but not a long-term need for the medicine, right? We don't want people to stay on this. We want people to use it, get better, and get done. And I'll share some. I alluded to some statistics or some data points from an outcome study that we did on our own population. And what we saw was an 86% improvement in PTSD, 65% improvement in depression, a 67% improvement in anxiety. And even better, when we looked at the symptom severity scales, we were seeing that we were actually able to, we were seeing patients moving out of a PTSD diagnosis. Almost everyone moved into a mild or minimum level of depression that were in, obviously the higher stages. And with anxiety, they were moving down 1 or 2 levels as well. So highly, highly effective.
Wow. That's so interesting, right? It's such a, when you're looking at it, because, insurance is always trying to they don't want to lay out a lot of money, right? That's their whole purpose, is how do they limit the amount of money they lay out while still providing some level of coverage. And so I can imagine that approach is very dramatically different than that of a pharmaceutical industry, right? They're a business, right? That's how they make money, is to get you to take their thing. So to move into this just is radically different approach, than what our traditional approach has been. I was wondering, with that, I know we've sort of talked about other, this emergence of psilocybin and mushrooms.
Mm-hmm.
How do you see that working into this modality, or this way of bringing mental health treatment to employers and unions and municipalities?
Yeah, great question. And I'm super excited about the potential opportunity to have employers and unions and municipalities offer, more traditional psychedelic medicine to their population. Psilocybin therapy, MDMA-assisted therapy, hopefully pending the FDA's approval in a few days, actually. And, I think from Enthea's perspective, we're only always going to be working with legal substances. And, we're looking at now in states where psilocybin therapy is legal, in states like Oregon, to be able to provide access to employers and unions that would want to have their employees go through those therapies. And when MDMA-assisted therapy is, and I'm going to say is, this is going to happen, FDA approved, then we, of course, will have access for MDMA-assisted therapy through our providers who are trained and able to provide those services as well. So, I think from my perspective, it's super exciting that, we're moving in this direction. I hope that we continue to move in this direction. And, again, these therapies are not going to be for everyone. So, when we talk to employers, it's important to help them understand that, I do believe that these therapies are really for your population that, they're struggling, they're suffering, they need something new, they need a better way, they want a better way. And I'm also excited that there's been receptivity for something that I think that the war on drugs has done a lot of damage to. And this whole re-education process around what the clinical research actually says and what the safety profiles actually are, I think is incredibly important. And, I'm just super grateful to be able to be educating and creating that awareness within a population that maybe may not have been as familiar with these types of approaches.
Now, when it comes to things like Oregon, right? So Oregon has as we heard from Ryan Reed with Bendable, there's a huge separation between they're not allowed to actually even call it therapy. Mm-hmm. How do you guys work? How does Enthea work with that in that kind of with those state regulations where it's not considered therapy or can't be considered therapy?
Yeah, well, I can't get into all the details because all of this is kind of still, being formulated. But ultimately, yeah, I mean, we would be aligning with all of the laws and regulations, and of course, they are, from I guess Oregon's perspective, they are wellness services, right? They're not therapies that are going to be used to treat certain mental health indications like depression, like anxiety, like we're able to do with ketamine assisted therapy. So, it's just, I think with anything, just really working within the rules and regulations, and making sure that we're compliant with that. And then, making sure that we're, supporting access for those that really need it.
Well, when you're approaching employers and unions, and this is a self-serving question because, with Psychedelic League, we're approaching municipalities, mayors, and town council, and I don't think they're probably so dissimilar in some ways from employers and unions. How are you doing it, and like, what are some of the things you've learned in approaching them, and what are some of the top three questions you've heard asked, or some of the most like dubious type of questions, like how receptive are they?
Mm-hmm.
What have you been hearing?
Yeah, good question. And municipalities, they have some populations that really struggle. They have frontline workers. They have firefighters, they have police officers, and many other people that are struggling. So I think I think the pain is there, in that they know that they need to provide really strong mental health solutions for their population. We definitely get questions around legality. I think people aren't as familiar with ketamine assisted therapy. So, just kind of getting that familiarity with the fact that it is legal across all 50 states. It has been in practice for a while now. There is, 25 years of research and data supporting both the efficacy, clinical efficacy. We have 60 years of safety data because we've been using obviously ketamine in very high doses, oftentimes in children, for 60 years. It's on the World Health Organization's list of essential medicines. So just so much stuff out there that I think just we need to bring awareness to just create this comfort level, and not a misleading comfort level, but like a real comfort level that, like, this medicine has been used safely and effectively for quite some time. There's a ton of data and research supporting it. So I think it's just focusing on the clinical efficacy, focusing on the safety, and then just bringing awareness to the fact that many people are treatment resistant, and we need solutions for them. And even just beyond treatment resistance, when we think about, the firefighters and the police officers, the level of PTSD that they deal with. And, PTSD is a really challenging condition. There are not a ton of effective solutions. And we know that these medicines can quite literally, improve and help people get out of PTSD diagnoses. So I think when they see the data, they understand the data. Yes, it's going to take time, and yes, there's going to be a lot of meetings to do a lot of education with a lot of people, but that's part of this process, and that's all necessary, And they should be taking those steps to make sure that they're looking into everything. But the data's all there, so I think that's the biggest. I would say those are some of the biggest questions. And then network, making sure there's a sufficient network to support their employees and members and where they're located. And then we'll also get questions around like, well, how do you implement this, right? So it's a traditional benefit. So we are offering this as a traditional benefit. And just like any other benefit, you're going to have, in many instances, a plan design attached to it. So employers think about affordability. How many people are going to use this, and are we going to be able to afford it? So that's where the benefit design comes into play, where we say, okay, what's your budget? And through that process, we work to design a benefit plan to say, okay, well, here's how much the employer will pay, and then here's how much the employee will pay through various cost sharing options like co-pays, like co-insurance, whatever it may be.
That's interesting. And would that be covering the integration specialist as well through a plan like this? And then like, these specialists, are they, would the plan designate a certain credential that they would need in order to be considered like a specialist who could get reimbursed for their work?
Yeah, so there is a very rigorous credentialing process for sure. So they do, when we go through that, they do have to have certain licensures and certain credentials to be able to come into our network. So that is super important. And we put a lot of focus and emphasis on our network because it's so important to have high quality providers. Providers obviously that are practicing the safest protocols, providers that you can trust, that have been vetted. So this kind of comfort level with the providers that we're working with is important. And sometimes I'll get questions around this being like an out of network group of clinicians and therapists. And the reality of it is many of these clinicians and therapists are in the traditional networks, just not for this specific treatment. So, I also help them to understand that, but we do go through the same credentialing process that TPAs and major carriers do. And the plan design does apply to kind of the total patient journey. So the the screening and evaluations, the preparatory sessions, the medicine sessions, and the psychotherapy and integration sessions. But ultimately, it is something that we customize with the employer.
Now, looking at, the fact that ketamine is currently legal, and in many states that are moving towards legalizing psilocybin, is this oftentimes whenever you're looking at the design of these therapies, is it something where they can work with both? We were talking to Dr. Hannah McLean previously, and she mentioned the value of, utilizing ketamine so that somebody can work with psilocybin. Mm-hmm. Do you see that as part of, when you're building out these plans as like a potential piece, or, do you find that, is it something where they have to choose one or the other, or can there be coverage for both?
Yeah, so I think as we move down the path of having additional medicines and therapies like MDMA assisted therapy or psilocybin therapy in the future as part of our offerings, then ultimately we would customize it again to meet the needs of the employer. So if they say, I just want to stick with ketamine assisted therapy and that's it, that's something they can do. If they say, I want to offer ketamine assisted therapy and MDMA assisted therapy upon approval, but not psilocybin when that's available, then that's okay too. So it's really a matter of how the employer wants to design it. And then I'll also add that the treatment plans are customized, right? So they're meeting with a clinician in our network to really design the personalized approach that is most appropriate for them based on the complexity of their condition and severity of their condition. So really everything is super personalized. I mean, the whole process in general, especially looking at ketamine-assisted therapy, is a super supportive and safe process. All of the costs that go into this treatment is really the cost of the clinicians, the specialists, the experts that are sitting with you and supporting you throughout this entire journey. So, it is a super safe and supportive process.
It'll be interesting, as these therapies become much more, used, more, we always learn more, right? Even with drugs, right? There can be the trial, and then that's actually what happens, when it's actually being used by, hundreds of thousands or millions of people. A question kind of comes up, well, why would not just stick with one? Why do we also need psilocybin? Why do we not also need MDMA? If ketamine is really great, why is MDMA needed? Sort of starting, I imagine education will be a big piece of that. It's, when you look at the rollout of these potentials with MDMA and psilocybin, how do you see that education piece fitting in? Do you see them as, I mean, I know there's the thing, not every medicine is for every person, right? Mm-hmm. And I mean, yeah. So what is your approach? What do you foresee to be your approach with that?
Yeah, it's going to depend on a number of different factors. So, for example, with MDMA assisted therapy, when that's passed, that's going to be for very specific indications. So that will be very targeted to, certain complexities of PTSD. So that's who will have access to that, at least initially. And then for ketamine assisted therapy, there's a broader range of conditions that we're able to treat based on, supporting evidence. And then I think think when you look at that and psilocybin, there is absolutely going to be a big education process around, what are these medicines? How do they work? What are they effective in treating? How strong is the clinical evidence for each indication? So I think it's going to really be coming down to just leveraging where we have the strongest amount of supporting evidence and supporting science and research that's connected to each specific indication. And that's what will help guide, who has access to which. And yeah, ultimately, I think just in general, education around these medicines, because they are so new to so many, is just such an important part of the process. And and I think just getting people comfortable, I think getting people aware and access to the supporting evidence and the supporting research that's out there, so they can do their own deep digging into this, I think is super important too.
So, how did you? You might have touched upon this earlier, but how did you come to form the Sage Collective, and what's your, are you, in addition to talking to employers and insurers, have you had any chance, or how would you think about approaching physicians? Because I think we've talked a lot here about approaching physicians, especially in New Jersey, where the legislation is requiring referral from physicians or similar. And then perhaps even requiring physicians to be not attending, but they're medical directors, effectively, of service centers. Have you had a chance to interact with doctors, and how, if you have, what's that been like? Talking about this subject matter.
Yeah, great question. So I formed the Sage Collective ultimately just because, I truly do believe that these medicines need to be integrated into the healthcare ecosystem. Now, I say that, and I also want to add that it's of course extremely important to make sure that these medicines and the approaches in working with these medicines maintain their integrity and their sacredness. There's a lot of kind of spiritual aspects to these medicines as well. So to make sure that they maintain that integrity is really important when we think about the broader healthcare ecosystem. But the reason I think it's so important is because, there's so many people that are struggling that can incredibly benefit from these therapies. But unless it's something that their doctor is going to recommend to them, or their doctor is going to educate them about, they're not going to be comfortable with engaging in these therapies. And when I think about, doctors and health systems, they're respected by many, and with them having awareness and education of how effective these tools are, they can also be those that educate and teach and recommend these approaches to their patients. And I think that's going to help from an access point. I think that's kind of the other side of the insurance. We have to have insurance and employers and unions that want to cover these therapies, but we also have to have providers and health systems that are willing to offer it. So in that work, I've done some really exciting projects that I've been super grateful to be involved in. And, I've worked with, for example, I worked with a health system, an academic medical institute, to evaluate psychedelic assisted therapies and their place in their healthcare ecosystem, in their health system. And, it was great. It was a really great experience to talk to the physicians, the providers, the leaders across the health system, to see their receptivity and to see that, they're even seeing that they only have so many tools in their toolkit to address, especially things like PTSD and addiction. And that, they're doing their absolute best with what they have available to them. But when you have these other options available to you that are so incredibly effective for patients, it was really exciting to see their receptivity, even though it was newer for a lot of the physicians. So it was a great experience to go through that. And, ultimately what I did was, prepare the business plan for them to integrate these medicines into into their system. So including things like evaluating, what does the space need to look like, to make sure we have the appropriate set and setting. So that's supported, what type of clinicians do we need? What's the economic model to support this? What are the appropriate treatment protocols? How do we educate and communicate to patients? What is the market opportunity? Obviously, they're going to care about that. And, how does that help them kind of compete in the area, which of course is something important for them too. So I think that like any new medication treatment or approach, I mean, these aren't new, right? They're psilocybin is around for thousands of years, and ketamine for quite some time as well, as MDMA. So it's just really that awareness, that education, that comfort level, and providing those resources to get people, I would say, up to speed on using these therapies. So, I love the opportunity to educate really anyone about these medicines. But I do think that that therapists and providers are going to be integral, and also making sure that while doing so, while we're creating that access and that education, we don't lose some of these really critical components to making sure that people are going through a journey that I would say maintains some of the sacredness around working with these types of medicines, because that's important.
Yeah, that comes up frequently. There's a dichotomy between the medical efficacy and the completely different paradigm that they kind of live in. Sorry, go ahead, Sara.
Yeah, no, I was actually going to ask a little bit more about the receptivity of that. Like when you do kind of like start talking about these, because we even see it in the hearings in New Jersey, right? It's this drug, it's this medication, it's put into the old paradigm. When you start talking with professionals in the healthcare field about this paradigm shift and its, sacred use, I mean, some would say like its own consciousness, right? It's this whole other way of viewing this medicine, not drug. Do you get like side eyes? Do you get like, what is the receptivity to that? Do they eye roll? Do they dismiss it? Do they embrace it? Like what is that response?
Yeah, I think there's a lot more clinicians that really are focusing on like the whole person aspect of this. So we've obviously been treating like different components of ourselves. So we've been treating our physical body and then our emotional body. And, I think we need to start looking at this as a whole person. And we're missing pretty big components of ourselves. Everyone to some degree has some sort of like spiritual nature to them, right? And to completely disengage that as like that being part of the human, I think is not fully accurate. So there are a lot more people that and clinicians that are recognizing that we do have to treat the entire person. And and I would say that people have definitely been receptive to that concept.
That's really awesome. It's interesting. Like as a nurse, I remember doing, any of the intakes, you do screenings and intake things, and even with like families in the NICU. And there was like a question to ask about spiritual, check the box, and then like move on to the other stuff, because apparently we thought the other stuff was so important. So it's really, I've been away from like the hospital system and the more like system-wide healthcare for a while. So it's really nice to hear that is something that there's receptivity to, versus just trying to check a box because someone says we're supposed to ask about this.
Mm-hmm. Yeah, I mean, I definitely see the uptake more from, I would say, clinicians that want to start their own wellness centers, similar to what we're seeing in Oregon, what's going to happen in Colorado. And there's just way more flexibility in how you can design the space and the type of atmosphere you bring. But, I think that when, other systems that do want to get involved in this, you can totally take the same approach, right? As long as you're willing to. And I think it's necessary. We've been treating mental health, I would say, in kind of a box for a long time. And I think it could use, I think the approaches could use a little bit of a refresher.
That's great. Mm-hmm. So we're like a little past 3. We really appreciate you jumping on with us and talking. I think you're really articulate in how you address I think it's a very complicated topic, psychedelics, and then integrating it with insurance and healthcare systems. But I think you're kind of doing it very seamlessly. So we really give you so much credit, and we're trying to take a cue from you as we keep doing work, to try to get the time, place, and manner restrictions and ordinances and zoning squared away for future wellness centers. So, but yeah, really thank you for sharing all your insights, and look forward to talking to you again really soon.
Yeah, thank you. I'm excited to be here. I'm super grateful for the opportunity, and I always love to talk about this stuff. So yeah, grateful and thank you so much.
Thank you.
Thank you.
And
It's
we'll
been
talk
awesome.
soon.
All right. And if anyone has questions too, feel free to
Oh,
message.
please plug. Yeah, again, like, can you do a quick plug again so people know where to find you?
Oh yeah, so you can find me on LinkedIn, Jessica Tracy. You can also find me through Enthea, and that is the work that I'm doing around bringing access to employers and unions, also EAPs as employee benefits. And my email there is jessica@enthea.com. You can also reach me through the Sage Collective too, and that is jessica@thesagecollective.co. Co.
Perfect. And I'll add all of this information to the post on LinkedIn on the bottom.
Wonderful. Well, thank you so much. It was really great. It was a pleasure.
Great
Yeah,
seeing
awesome.
you.
Thanks so much.